Hey there, Jennifer Bell here, your Medicare licensed insurance agent here in the state of Colorado. And I am here to talk to you today about the cost associated with Medicare Part A. Now, if you haven't yet, I did do a video on what Medicare Part A is. So please take the time to watch that. It's a short watch, highly recommend it. Today, what we're just going to talk about is the cost associated with that. So Part A is your inpatient hospital stay coverage. And what that means is whenever you're admitted to the hospital as an inpatient, Medicare Part A is what is going to be the part of Medicare that pays your hospital stay. What that looks like is a little different than what we're used to, I think, on the insurances that we've had prior to Medicare. Now, your inpatient hospital stay deductible upon admission and for the first 60 days of your stay is $1,364. Once you're there for 60 days, that's your hospital stay copay. Of course, now there's doctors and things like that you have to pay, but you're gonna have that hospital deductible. Heaven forbid you're in there longer than 60 days, and we know it can happen, unfortunately. There is a daily copay set in place beyond 60 days. Medicare is gonna pay everything except $341 a day, and that will be something you would be responsible for. That's going to happen for days 61 through 90 of your hospital stay. Now, anything beyond 90 days, what happens is you start to dip into what's called a lifetime reserve bucket. And what Medicare has done is they put these 60 days off here in the sky, and they say, we're going to give you these 60 lifetime reserve days in the event you ever have a stay longer than 90 days. Once you use one of those reserve days, they're gone forever. So an example of that is if you have a 95-day hospital stay, you've now used 5 of your lifetime reserve days. And what that means is for the rest of your life, you now have 55 days left in that bucket of lifetime reserve days. Now, the unfortunate thing is these reserve days get really expensive. So the previous daily copay for days 61 through 90 was $341. We're going to double that if we ever have to dip into those reserve days. So now we're looking at $682 a day that we have to come up with. It can be really scary and definitely something that you want to have an additional insurance policy in place to protect you from. But that's what it looks like if you just have Medicare all by itself. The next part of the Part A bucket is a skilled nursing facility stay. Now, something that's a little bit tricky about skilled nursing facility is prior to being admitted to a skilled nursing facility, you have had to have been an inpatient in the hospital for a minimum of 3 days, and it's 3 24-hour periods. Once you've been an inpatient in the hospital for 3 days, you can transition to a skilled nursing facility. And generally, this has to be within 30 days of your hospital stay. That might sound a little interesting, but let's say you have a hospital stay of 3 to 4, 5, 6 days, and you go home. And then once you go home, you realize you just can't do it on your own, and you really need to go into a rehabilitation center where you can have some skilled nursing assistance with you. That's why they say within 30 days of your hospital stay. Now, once you're admitted to a skilled nursing facility, following a approved 3-day hospital stay, you will have the first 20 days in the skilled nursing facility covered. Medicare is going to pay for everything. Now, if you ever exceed a 20-day stay in a skilled nursing facility, you'll start to incur a daily copay. And it's going to max out at 100 days. Medicare is only going to pay for you in a skilled nursing facility at the max of 100 days. What that means is day 21 through 100, each day you would be responsible for a daily copay of $170.50. Now, it caps out at 100 days because unfortunately, Medicare doesn't cover long-term care. So, if you're in a position where you're not showing signs of improvement, you're not getting better, then Medicare starts to look at that as a custodial care need, meaning someone has to be there to help you change your clothes or go to the bathroom or maybe help feed you. And these are all what they call activities of daily living. They're not activities that require a skilled nurse to be there. It can be a nurse's aide or a family member, anything like that. So Medicare says, you know what, we don't cover long-term care. Same thing goes in the hospital. Now, I mentioned there was that 60 days lifetime reserve. What that means is if you ever have a long hospital stay, the longest that you could stay on original Medicare and have it be paid for the entire time is 150 days. Once you've maxed out those lifetime reserve days, unfortunately, you'll be responsible for the entire cost incurred at the hospital. Now, I do want to point out that Medicare is designed for acute recovery care. And what that means is you're always showing signs of improvement, you're always getting better. So if at any time during your hospital stay, the physicians, the nurses, the therapists know that you are not improving, Medicare will actually stop paying early. Personally, I've had a client who her insurance stopped paying after 20 days because the condition that she had was terminal, and unfortunately she didn't make it much longer. I had it personally happen to me and my family when my grandmother passed away. She'd been in the hospital for about 10 to 14 days when the nursing staff knew that she wasn't going to be coming out. And so they approached us to talk about discharge and getting her out of the hospital because they knew Medicare was no longer going to pay. So just keep in mind that Medicare is really acute recovery care. It's not long-term care. And they can cut you off at any time if you are not showing signs of improvement. So just something very important to remember. It hit home when I saw it happen right in front of my eyes with my grandmother. Couldn't believe it. But you know, I talk about it every single day, and then I actually witnessed it. So it was quite an eye-opening experience. If you have any questions for me, please don't hesitate to reach out. You can email me. I'm happy to answer any of your questions and walk you through any processes that you need help with. Thank you so much for taking the time to watch this video. Share it with your friends, and we'll see you on the next video.